Forgetting where you put your glasses or not remembering a scheduled doctor's appointment is not necessarily a sign that you're losing your memory.
But how do you know if you should be concerned? As Cerise Cole reports in this month's health check, getting your memory screened is a good first step.
Arlene Walter is 85 and still on the move.
I'm always ready to go.
But sometimes her memory can't keep up.
I have a little trouble remembering people's names. It's so frustrating. And you know them, and you almost feel embarrassed.
Dr. Kylee Stanley says that's something that will likely happen to all of us as we age.
Hi, Arlene.
The key is to have your memory screened.
The first thing we need to do is just have you complete this puzzle.
Dr. Stanley's job is to assess Arlene's memory.
Do you know the year?
And yes, 2017.
Simple questions help her provide a complex diagnosis.
There's some different layers of memory difficulty. There's what we call normal aging.
For example, forgetting where you put your keys? Well, that's a typical aging problem. Not knowing where you are when you're driving indicates a bigger issue.
The middle layer is mild cognitive impairment, and then the final most concerning memory issue is dementia.
Now, to slow down memory loss, Dr. Stanley recommends a few things like reading a new book, doing word searches, crossword or math puzzles, even learning how to use an iPad. But you have to challenge yourself.
If you do crossword puzzles every day and you're the best person at crossword puzzles, that's not your mental challenge. You need to find something new and different for about 30 minutes a day.
Back in the exam room, Dr. Stanley uses basic techniques to test Arlene's recall ability.
Repeat these sentences exactly as I say them. I only know that John is the one to help today.
I only know that John is the one to help today.
For Arlene,
I think you're doing all the right things.
The news is good. The 85-year-old gives her 3-year-old great-grandson credit
Because he is so active and he knows everything.
for keeping her on her toes and her memory in check.
Good job. We'll talk again soon.
In Fremont, with photographer Dustin Dales, Cerise Cole, WOWT 6 News.
And Dr. Stanley says physical and social activities can also help reduce memory loss, but she says you have to do a combination of cardio and weight-bearing exercises. As for social activities, you get the best memory benefit when you try new experiences and also meet new people.
Like remembering how to spell your last name, right? Or your first name.
You forgot that today, but that's all right. It happens.
Spell it with 2 L's.